Inflammation's important. If your body can't do inflammation, you're not going to last long. They say inflammation is the immune system's first response against infection or injury, and that is a half-truth.
We've heard a lot about vaccines, but what we haven't heard as much about is that there's nutrients that can actually not necessarily create antibodies, but can act like a trigger lock.
Glycine doesn't fight inflammation, it just turns it off so it doesn't get started. The last time I was scanned, about a year or two ago, it said I had the average coronary arteries of a 28-year-old. Almost everybody's glycine deficient. That's what I discovered through self-experimentation. They'll take blood tests from 1 million people and they'll say, what is the average range of glycine, plus or minus 2 standard deviations? That's the normal range, but it doesn't mean it's the healthy range. It's glycine in the beginning, glycine in the end. Glycine is the alpha and omega of inflammation. It's the trigger lock that stops the first step in inflammation.
Hi friends, 60% of Americans today are living with some sort of chronic disease, and many of them have inflammation, inappropriate, chronic, excessive inflammation at their root. And while the traditional model often tries to suppress inflammation, what if there's a nutrient that could actually just turn it off when it wasn't necessary? That's what we're here to talk to Dr. Brind. He is a biochemist. He's a Yale-trained NYU biochemist, and he hates it when I say it, but he is, I would say, the glycine expert. I even just had someone reach out to me today who's heard our other podcasts and say, I have a Dr. Brind story now. And I went into AI, and Dr. Brind is in AI. They recommend no less than 10 grams per day of glycine based on what he's sharing. And they were telling me how they went and overworked themselves at 73 and they were actually not sore the next day because they went home and they took their glycine. So today we're going to talk about the link between glycine and inflammatory conditions with our fan favorite, Dr. Brind. So welcome to the show.
Oh, thanks a lot. That's a great welcome.
Yeah. That's
a nice way to start the day here. Okay.
I'm so glad you enjoy it. And it's so sincere. Thousands of comments from people who your teachings have helped. And I'm just so grateful to have you here. So before we get into what is inflammation, what is the cascade, what are the cells, and how do we turn it off when it's not necessary, tell everybody why you are an authority on the topic of glycine.
Well, I wrote a book. Doesn't that make you an authority on something?
No, there's other things too.
It's well researched. I've got all my sources in there, my experience, my self-experimentation and everything. And the main thing is that I made a very important discovery about glycine and inflammation. It's still not known. It's just a matter of getting it out there. And that is, it's a very fundamental misconception that all of science and medicine still has about inflammation. They say inflammation is the immune system's first response against infection or injury, and that is a half-truth because it is only a natural response against infection, not against injury, because all it does is cause more injury, because the idea of it there to go against infection is to kill whatever microbe managed to get into your body before it kills you. And it does no good at all if you get a bump on the head or a sunburn or any kind of a sterile injury. It does no good at all for it to get inflamed. It only makes it worse. It only delays healing. It doesn't initiate healing. It delays it. And this is just a misunderstanding, which I shared with everybody else till self-experimentation woke me up to the truth about it. And it's very interesting how it follows, this misunderstanding follows from a misunderstanding and calling things by the wrong name. Like, for example, calling the amino acid glycine non-essential. Just because your liver can make it from scratch doesn't mean it makes enough. So it is actually essential, or what we might call conditionally essential. For most of us, that means it's essential because when you eat meat, fish, and poultry, for example, you eat a lot of excess methionine, which is kind of an opposite to glycine in the sense that glycine is needed to clear excess methionine. So we eat too much. So in a modern diet, we do a number of things which in 3 different ways makes us glycine deficient. First of all, we don't eat the glycine because we throw the bones and connective tissues, which have the collagen, which has most of the glycine, into the trash instead of into the soup. So what happens is we don't eat the glycine we should eat. The second thing is, by doing so, we're eating a lot of muscle meat, and muscle meat is high in methionine, which depletes glycine because we have too much of it, and that makes your system, your body, deficient in glycine because that glycine is needed to clear the excess methionine. And then third of all, by eating too much of just about everything, we get overweight. And when you're overweight, guess what? It shuts down your liver's production of glycine. So you're making less, you're eating less, and you're clearing it more rapidly because of what we're eating more of. And you put all that together, and the modern American diet makes people much more glycine deficient than we ever were. Even though we probably were somewhat glycine deficient before that, at least most of us. Now almost all of us are, except for those who take glycine supplements like me and so many of my customers who take Sweetamine, which is the glycine supplement that I make, and those who are real bone broth enthusiasts who eat something like a quart a day's worth of bone broth or collagen supplements or gelatin supplements, which is really collagen. You know, any of those things which will give you enough glycine. Nowadays, you can even do it by taking a lot of magnesium supplements if it's magnesium glycinate, because magnesium glycinate is 86% glycine.
Yeah. So like 1 to 2 grams in maybe a 300 milligram dose or something.
In a 300 milligram dose, you're getting, yes, in a 300 milligram dose of magnesium, if it's magnesium glycinate, at the same time, you're getting 2 grams of glycine, which is about a fifth of what you need. You need about 10 grams. My supplement is 8 grams because we usually get 2 or 3 grams in the diet. A lot of people say, oh, they're carnivore diet, I get lots and lots of glycine. You get a day's worth of glycine and a big turkey drumstick or something like that. You get a lot of glycine, but you also get too much methionine with it. It's a matter of the balance. So even though meat eaters who just eat the muscle meat basically eat a lot more glycine than vegans do, for example, and studies have shown this. A very prominent study in Oxford in 2015 showed this, that you may eat a lot more glycine and all the amino acids than anybody else if you have a very high protein diet that's very high in meat, fish, and poultry, but you can still be glycine deficient. And if you're a vegan, you still have more glycine in you than the meat eater, because again, the methionine, which is that essential amino acid that we have way more than we need, is treated then like a toxin, like you have too much. It's almost treated kind of like sugar. Sugar is one of those things that you have to have in your system. So your body has ways of generating sugar when it's too low, making it out of protein, making it a little bit out of fat, making it out of whatever it can get in order to keep that sugar level up. And the same is true for methionine. It recycles and regenerates and uses methionine, although it is essential, so you got to have some. But it's so efficient at recycling it and regenerating it that you really need very little. Methionine is really, and then in that case, it's more like a vitamin. You need something like 300 to 500 milligrams per day.
And what does that look like? What's that a portion? Like, is that 5 ounces?
Milligrams?
6
It's like
ounces?
a pill. The regular large size capsule is about 500 milligrams. Not the giant capsules. You know, some of them, the really, really big capsules, you can get a whole gram in, 1,000 milligrams. But the ones that you would consider kind of ordinary, sort of large size capsules that are easy enough to swallow, those usually hold about 500 milligrams. That's all the methionine you needed. And if all the glycine you needed was that much, I'd say, well, sure, let's take a capsule of glycine, one and done, and forget about it. But you wouldn't want to take 16 of them every day. That would be more like a chore.
Yeah.
You know?
And I was looking this up. So for beef, maybe for 3 ounces, say, of beef, you might have 600 to 700 milligrams of methionine. Is that about correct?
I don't
So
know. You looked at it. Sounds like you looked it up more recently than I have.
I sure did. And then I was thinking, so if you have that and you're a carnivore, like we've never really done this exercise, but I think it's interesting.
Yeah.
So vegans probably have very little methionine coming in, much less, But if you're a carnivore and you're eating that, maybe twice that, 3 times a day, so you're up around, I don't know, 2 grams of methionine, 2 to 3 grams of methionine. So what does that do?
Yeah, at least 3 grams probably, because 4 ounces of meat is a very small portion anyway.
It is, especially if that's all you're eating. So what does that do? Because I know if you have 10 grams of glycine and 500 milligrams of methionine, that's like a 20 to 1. So what would that look like?
That's the need. That's what you need. Yes, it's exactly.
Yes. Would you need that much more glycine? So would you then need like 50 grams of glycine, or would you stick around that?
Well, not 50 grams, because glycine is a smaller molecule, so maybe about half that. So you just need the same number of molecules of glycine. You need 2 molecules of glycine to get rid of every 1 molecule of excess methionine. Excuse me. It's even more than 2, because you actually use 1 molecule of serine, which is 1 step away from glycine. So I say at least 2. In realistic terms, it's probably a little more like 2.5 on average of glycine, but that's molecular wise. Glycine's a much smaller molecule. It's the smallest of the amino acids, so it comes out to about half the number you said.
Here's what I think I'm learning from you. Clarify if I'm wrong. That basically we need to get over 10 grams or around in order for it to have this inflammatory modulating effect.
Yeah, I
But
know why you say suppression, because it is suppression in the sense that it doesn't even get started. It turns it off at the source.
yes, but appropriately,
It
not like
doesn't, in other words, I
suppression.
like to say there are a number of supplements, turmeric and, balance of nature stuff, and, there are a lot of things that they will claim rightly fight inflammation, but glycine doesn't fight inflammation, it just turns it off, so it doesn't get started. These other things, including drugs, not only the supplements I mentioned, but also drugs. These biologic drugs, the MABs, the monoclonal antibodies, which you see like Humira on down, which are drugs that target particular products of inflammation, particular aspects of that cascade. And that's why you have those small print warnings at the end of the commercial. Don't take it if you're anywhere around anyone who's infected with anything, especially TB or fungal infections or anything like that, because those are drugs which specifically are intended to disable a vital aspect of your immune system. Inflammation's important. If your body can't do inflammation, you're not going to last long. The trouble is it does it for all the wrong reasons, way too much of it. And usually inflammation it's really just there in case you get some infection, whether it's through a cut or an injury or through something you eat or something you breathe in. Anyhow, that a pathogen, a microbe that causes disease, gets into your system, that's what inflammation's for, if you don't have a specific antibody to go against it. So when a new plague comes to town, like when the plague came to Europe and killed 2/3 of the people living there in the 14th and 15th century, it didn't kill everybody because the innate immune system, basically through inflammation, was allowing most people to avoid dying from the disease. So you have the same thing with Ebola. Ebola, they say, a terrible disease, 50% mortality rate, and remember how everyone was so scared of Ebola? Yeah, it was 50% mortality among those who got sick, but among those who were actually exposed and who may have been infected with Ebola, most of them never even got sick. They just got immunized.
Yeah, break us that down because you're a professor, you know all about the innate immune system. So tell us, what is inflammation? And then we'll talk about how glycine fits in later, but give us a high level overview.
Yeah, so we're used to speaking about the immune system. It protects us from disease. How? It makes antibodies. Antibodies target specific bugs, bacteria, viruses, fungi. It will target them and mark them for the immune system to go after with its various specific cell and molecular targeting mechanisms and get rid of it. However, if you're infected with some new bug that your immune system has not seen before, well, that's going to be kind of tough because it takes actually a few weeks to make specific antibodies that specifically chemically target a particular pathogen. So you're out of luck if you don't have any antibodies, except that we have innate immunity, which is relatively non-specific. It will be activated as soon as it senses the presence of just about any kind of pathogen in general, something called bacterial lipopolysaccharide from the cell coat, the coat protein of a bacterium. Generally, bacteria will have lipopolysaccharides on their exterior. Well, we don't have lipopolysaccharides usually, that kind on our cells. And so when your immune system, specifically those first responder cells called macrophages, when they detect the presence of there's bacteria in here, there shouldn't be any, there's fungi in here, there shouldn't be any, it will then get activated to start secreting poisons, which is going to kill just about anything that's around. In the meantime, it can damage normal tissue, things like hydrogen peroxide, can damage cells. You may lose some vital cells, some actual viable cells, but it's okay as long as you kill that infection. You may get sick, but then you'll get better. It's better than not getting sick and just dying. Or getting sick acutely very, very quickly and dying from a disease. So that's what your immune system's designed to do. It protects you from pathogenic microbes that your body hasn't seen before. And in fact, what happens is that's what starts the chain of events that leads to making specific antibodies to these microbes. The macrophages gobble up these bacteria, let's say, and internally to the macrophage cells. It chews them up into little pieces, and then the little pieces end up floating around in the cell membrane of the macrophage. And then other cells of the immune system, T cells and B cells, come in contact with the macrophage, and they get together in lymph nodes, and they multiply the cells which are capable of making those antibodies that are specific to that microbe that the macrophage found and ate. And now you can make lots and lots, milligram quantities of specific antibodies, and now you can really fight that disease off well. And if you have an exposure then in the future, now you know how to make antibodies to that pathogen, so you won't get sick anymore. And that's really the basis of vaccination, to give you an exposure to that pathogen without making you sick, but making your immune system primed and knowledgeable, if you will, as to the chemical structure of that microbe, so that if your body sees it again, if it gets inside you again, you'll be able to get rid of it with a minimal kind of disease. You know, maybe you get it on your nose, but you won't get that potentially life-threatening disease that otherwise smallpox or polio or anything like that might have caused.
I love it. That's a beautiful explanation. And now we've heard a lot about vaccines, but what we haven't heard as much about is that there's nutrients that can actually not necessarily create antibodies, but can act like a trigger lock. And I kind of just want like a perspective. Are there other nutrients as important as glycine? Or would you say glycine's the most important, one of the most important for our immune system because so many people are deficient?
Yeah, glycine is the most important. There are other nutrients like, for example, taurine, which can actually act like glycine. Not quite as good, but good for a lot of things. But taurine can substitute for glycine in that role of interacting with the so-called glycine receptor. And interestingly, it's the same receptor that we have in our central nervous system, because glycine is also a neurotransmitter, which helps to facilitate nerve transmissions. In fact, its main role in the central nervous system is as an inhibitory neurotransmitter. So it inhibits excitatory transmission. That's one of the reasons why glycine helps you sleep. It doesn't make you sleepy, but it can help you sleep if there's all kinds of other stuff going on. It can help to quiet the noise, and by quieting the noise, it can help people sleep. And a lot of people report using it as something to help them sleep. But it's the same molecular mechanism by which it serves as a trigger lock for inflammation, because it's the same glycine receptor, which is like an electrical switch or part of an electrical switch mechanism that keeps those macrophages from getting activated into the so-called M1 mode, where they go around shooting up the place with poisons, where they actually start that inflammatory cascade of poisons, which are designed to kill whatever it is that got into you before it kills you. So that glycine controls that very first step, because that activation has to do with, it's an electrical phenomenon that happens at the cell membrane. It's called depolarization. Very fancy name for flipping on a switch. But I turn the switch, look what happens, the light went off. Why? Because on the two poles of the switch, the two wires connected to that switch, one has current in it, one does not. So there's a polarization. One is electrically charged, the other one is not charged. The voltage between them, therefore, is that 120 volts of charge. I turn on the switch, bingo, now on two sides of that switch, there's zero voltage. They're connected. So now the switch is closed, which is to say on. Now the electrons can flow, and now the light is activated. Well, in the same way, when the voltage goes down to zero, when the cell surface gets depolarized, it gets activated. Well, it can get depolarized just because from the ordinary exercise of cells doing what they do, especially if they're in phagocytosis mode, when they're cleaning up the mess, going around like little amoebas, and gobbling up bits of cells and cell debris and dead and dying cells. That's good. That's the so-called M2 mode. But from doing that, if there's not enough glycine around, there'll be leakage of ions. Ions are electrically charged particles in solution that give that electrical polarization its voltage. So that normally a cell has a voltage that's about 70 millivolts, 0.07 volts. Unless you're an electric eel, you don't have high voltage. We have very low voltage between the inside and the outside of a cell of about 0.07 volts. And that's negative on the inside, positive on the outside. And if there's a lot of activity going on in that membrane and you get enough leakage of the usual kind of ions that you find inside and outside the cell. So you have potassium ions inside the cell, may leak out. Sodium ions may leak in. Chloride ions may leak in. Potassium ions leaking out. Generally, the overall leakage will tend to equilibrate, tend to make it equal inside and outside. You don't want the inside and the outside of your cells to be equal in their concentration of different ions, because then you're dead. A dead cell doesn't have any difference between inside and outside. There's no difference in temperature between inside and outside if you're dead, right? You're room temperature. So you don't want that. You want that living potential. So that's, as I say, negative inside relative to outside. Well, what a glycine receptor actually is what's called a glycine-gated chloride channel. Glycine is like a hand that works the gate, that turns the valve, that opens these chloride channels. So the glycine-gated chloride channel is open. That means chloride ions will come in, because normally chloride ions are high outside the cell, low inside the cell. So when you have a specific channel that is open to chloride, then chloride comes in. Well, chloride has a negative charge, and the inside of the cell is negatively charged relative to outside. So when you allow enough chloride to come in, it keeps that inside and outside voltage, that polarization, up, so it can't deteriorate and end up with the cell being activated inappropriately. So that's how the glycine receptor works, to stop the activation of a macrophage inappropriately from, let's say, just injury. Because when you have injury, you have cell damage. When you have cell damage, it draws macrophages over to the area to do what? To clean up the mess, to phagocytize, to gobble up all those dead and dying cells, but not to kill anything if there's nothing to kill, so not to cause inflammation. So that kind of polarization happens accidentally in almost everybody, because almost everybody's glycine deficient. That's what I discovered through self-experimentation. How long ago was that? That was about 16 years ago.
And so you talk a lot about macrophages. I did have someone reach out and say, oh, well, neutrophils are actually preceding macrophages, and then there's mast cells. So do you feel like, is there any research to suggest this happens in cells other than macrophages? I know you said the nervous system, but can you tell us how widespread is this effect in the body?
I consider neutrophils to be blood macrophages. Sometimes when you oversimplify things, it muddies the water a little bit, but sometimes in order to clarify things, you need to distill things down into their essential properties. So as cells go, as immune cells go, I consider the neutrophils are the main kind of macrophages that you find in blood. So you have neutrophils, basophils, and eosinophils are all basically kinds of blood macrophages. You've heard of, for example, asthma and COPD with chronic asthma and so on, and now you see drugs marketed specifically targeting eosinophils. Eosinophils, I consider them, my own categorization, they are macrophages. They behave like macrophages and share many of those characteristics, including glycine receptors. When it comes to mast cells, they're also very similar in some ways, and so theoretically, I suspect that they should help to stop mast cell activation, but there's very, very little research on it. There's some research on milk allergy, which seems to be related to MCAS, mast cell activation syndrome. So it may well be that glycine can protect against that. I do not know of any real research on that, and because MCAS it's kind of a it's a serious condition, only because you can get like a serious allergic attack without warning from almost anything, from a whole variety of different things that can activate mast cells. When that happens, that's what you need, the EpiPens or the Hello Neffy nose things or whatever they have, to give you a dose of epinephrine so that you don't die from anaphylactic shock, which is when everything gets activated kind of all at once. Glycine should help against those, but that's the kind of thing that's really, rather than as an ordinary supplement part of the diet, I would say, if you're talking about supplements, if you have that kind of medical condition, you really ought to check with the doctor.
Yes. None of this is ever medical advice, but
because just about when you have a sort of a hair trigger kind of medical condition, even if otherwise, as long as you stay out of trouble, you're fine. You live to 100, but you might succumb to something very quickly if those things get activated. So it's theoretical. I expect that glycine will be found to be protective against that, but we'll
have to wait.
Research. I don't know of any research that demonstrates that.
Yeah. And I want to kind of now go through some of the conditions. And like you said, food allergies. There was an animal model that showed that glycine can help prevent the development of a milk allergy, cow
Right, that
milk
was the one I
allergy.
was thinking of. Yeah, right.
That's what I thought. So we could also hypothesize that maybe this rise in food allergies, there's a lot of variables, right? There's glyphosate, there's many
Right,
gut
yes.
dysfunction. Could we hypothesize that glycine deficiency, because probably our kids with 67% of their diet coming from ultra processed foods, they're probably more deficient than adults. So can we surmise
Mhm.
that maybe giving children glycine or not giving children glycine rich foods could have contributed?
Well, I think everybody's kind of deficient. So yeah, glycine deficiency can contribute. That's the kind of thing that maybe vaccines. And I'm not an anti-vaxxer. There's certain very few vaccines that you need, but now they give like 20 or 30 different vaccines to kids. And when you are priming the immune system to react against such a wide variety of things, it's just common sense to think that might be a contributor also. So I think we tend to be over-vaccinated and undernourished in terms of glycine.
Yeah,
So
underglycinated.
for all those, yeah, underglycinated. I think most people are suffering from hypoglycemia. Now the doctors will say, "Oh no, most people are normal." But what normal means is what most people have. So
Yeah.
they'll take blood tests from 1 million people, and they'll say, "What is the average range of glycine plus or minus?" 2 standard deviations, that's the normal range, but it doesn't mean it's the healthy range. Normal range of glycine is somewhere between 150 and 350, 400 micromolar, but I think unless it's more than 500 micromolar, it's not healthy. We are an under-glycinated society, largely, I think, because of basically eating the muscle meats and throwing the bones in the trash instead of the soup.
I know, so
Not
sad.
like what your grandma did. She put everything in the soup. You didn't waste food that way.
I know. And it's not only, eating such a small portion of our diet from actual real foods too, right? So it's that and
Well, yeah, because they tend to be deficient. If you're just getting
yes.
something that's purified this and purified that, a synthetic diet, I guess it's okay on a mission to Mars. We'll find out, won't we?
Yes, we
People are months and months on synthetic diets because we kind of know most of what you need in nutrition. And then maybe, there'll be some kind of, here's a prediction, in another 20, 30, 40 years, there'll be a strange disease for people who go to Mars. Oh my God, they have this strange disease. Nobody's ever seen it before. What is it? What is it? And then they'll discover that it was a deficiency in some nutrient that was unrecognized, so they didn't put it into the food.
I think that's just wisdom because 30,000 compounds, like I said, in just in beef when we were studying
Right.
beef. And so yeah, food is so complex and our
Yeah,
knowledge is
except they'll probably send them with balance of nature or something, and they'll end up getting everything. But but that's
okay.
what it's like. So everything is synthetic. You have to, eat the whole balance, eat a whole diet, and it's really a whole foods thing with meat, fish, and poultry. The bones matter. That's,
I
by
think
the
so.
way, probably the basis of at least 50 years of data, epidemiological data showing that vegans are healthier than meat eaters because they live longer, they don't get as much cancer, they don't get as much heart disease. Isn't it healthier to be a vegan than to be a meat eater? And the answer is only because traditionally meat eaters throw the bones away and tend to be glycine deficient. Whereas when you're a vegan, you have to be careful to make sure you get all of, B12 and all these other things that we take for granted because there's so much of it in meat, fish, and poultry. So when you don't eat meat, fish, and poultry or animal products at all, you have to be careful and make sure that you get enough balance. Well, I think most vegans are like that. They do pay attention to all the nutrients they're getting. That way, you tend to be less deficient in glycine or any other thing in particular. When you eat a partial food, let's eat the meat, throw the bones away, you're in trouble.
And they've also, have
That's
you
it.
heard of the health food shoppers study?
No,
This is
what's that?
interesting because I think a lot of what, like you're saying, vegans as a category of people pay a lot more attention, probably
Right.
a lot more health conscious. And so what someone did was do a trial at Whole Foods, people who shop at Whole Foods. So kind of eliminating that variable of people who are health conscious. And they found people who shopped at Whole Foods, there was no real difference in the length of their life. And so I agree
Between
with
them
you.
and people who
And
didn't.
meat eaters. So
Oh,
meat
oh, you
eaters who
mean
are
vegans
health
versus meat eaters? Yeah.
yeah.
That's what you should find, I would think. Yeah.
Yeah, and especially then we add the variable of adding the glycine back in, and I think like you said, I think it's not the vegan diet. It's probably these other factors. But now take us, Dr. Brind, would you tell us what inflammatory conditions? We've talked about food allergies. We've hypothesized about that. Mast cell activation syndrome. Now, what about something like asthma or autoimmune conditions? How would glycine, do you think it would fit in there as well?
Well, I think probably with asthma, I would say yes. I would think. Because again, a lot of that has to do with the eosinophils, which, as I said, is what I consider one form of blood macrophage, because it has that same role in the immune system and the same kind of reactivity. It just happens kind of in the blood. And then when neutrophils, they can extravasate, that's a fancy word, extravasate.
I don't know if I've heard it.
Extra outside of vas, like in vessel, right? So when they leave the circulatory system, they will act like macrophages in the tissues. When there's a source of infection or something, they will be extravasated from the bloodstream into the tissues where they can do their cleanup routine or their inflammation routine as necessary. You talk about other conditions, almost everything nowadays is blamed on excess inflammation. You can see how, for example, in cardiovascular disease, plaque formation happens because of injuries inside the blood vessels. Oh my God, I get injuries inside my blood vessels. How does that happen? Well, it's called blood circulation. It's a very high pressure system, and especially when you get these branch points, like the principal branch point, the very first one is the first branch out of your systemic aorta are the two main coronary arteries. Wherever you have a branch point in a high pressure fluid system, you get turbulence. And wherever you get turbulence, you get injury, even micro injury. So just from, vigorous exercise of any kind, I thought that was good for you. Yeah, it is good for you because it causes minor damage to the internal surface of the blood vessels, but that usually just heals. So there's no problem. That's made to heal that way. In the same way as muscle. When you do a workout, you want to build muscle, it's natural to build muscle, but part of that routine is to cause a certain number of those microscopic fibers in that muscle to actually break. You tear a little bit of muscle, and then your muscle tissue says, wow, I need more fibers here to be able to bear this load, and so your muscle grows more fibers. It's called a living body. It does that kind of thing, right? So that's fine because it's just building muscle. It naturally heals. But what happens when you go and do a workout? Well, you do a vigorous workout. I feel great. I feel tired, but, no pain, no gain. Now I'm done with my workout. I'm great. And then the next morning you wake up and everything hurts, right? Because you did this very vigorous exercise. No, it hurts because those injuries to the muscles that you caused in order to stimulate them to grow and get stronger, they have now generated inflammation because you're glycine deficient. So now, after, the day after a snowstorm, after shoveling snow, as I used to do living in the Northeast for many years, most of my life, I would shovel snow for an hour, and then the next day I would be sore. I would have a sore back all the time in my 20s and my 30s and so forth. But actually, when I was in my 60s and I did that, I wasn't sore anymore because I started taking glycine supplements. So that kind of soreness, muscle recovery is hampered. It is inhibited by all the inflammation that takes place because we're glycine deficient. So it's great for muscle recovery. Inside the blood vessels, the walls of the actual blood vessels, when you're glycine deficient and you get inflammation, then your body is trying to put a patch on it all the while. It's, trying to fight an infection that isn't there, which is not good, but that's what happens. So over and over again, chronically, this is what leads to, atherosclerosis. So in the coronary arteries, it leads to heart attacks. In the carotid artery, it leads to strokes. In the renal artery, leads to malignant hypertension. All of these, or peripheral arterial disease. All of these things are attributable to chronic inflammation, which was inappropriate to begin with. Doctors will say, well, we don't know what starts it, but usually inflammation's okay, but then it's self-limiting, and we don't know why it becomes chronic. And the misunderstanding is that inflammation in these situations doesn't belong there at all, should not happen.
So if people have high blood pressure, would this be even more important because more likely to cause injuries?
Yeah, it would. Like, for example, I have high blood pressure. It's nerves and hormones and things like that. And so, I take one mild medication for it. It takes care of it. But I'm not glycine deficient. So I also don't have atherosclerosis. You look at my, arteries, my, what is it? Echocardiogram, all of this kind of stuff, it's all normal. The last time it was I was scanned about a year or two ago, it said that I had the average coronary arteries of a 28-year-old. So I'm
Wow.
a little more
Wow.
than that. Not
What's
quite triple that yet, but
Yeah,
I'm a little more than 28. You
that's
know,
impressive, Dr. Brand.
yeah, and
Especially
my wife
because
even less. She's like a newborn.
that's amazing, especially because you have told on prior podcasts, and this type 2 diabetes also has an inflammatory component, but that you were inching up into pre-diabetic territory.
That's
And
right.
so
Yes.
despite that, you still have these squeaky clean
Well, yeah,
arteries.
because that has to do with what's actually happening in the arteries, in terms of bulk flow and turbulence and damage to the arterial wall. But guess what also has glycine receptors? The endothelium of the
Blood vessels.
the blood vessel liner, that living layer of tissue that actually protects that lines the blood vessels. They have glycine receptors also.
Nice.
And that actually has to do, in terms of glycine, with cancer growth. It can actually inhibit the growth of cancer because it inhibits the ability of a tumor to generate a blood supply. In terms of initiation of cancer, that's also relative to inflammation, or it depends. In large measure, it has something to do with inflammation. That is to say, inflammation where a lot of damage is going on, damage to cells and so on, ends up causing more than normal levels of damage to DNA, and cells becoming abnormal and potentially cancerous. So it's sort of if you have an inflamed body chronically, that's sort of an incubator for cancer cells to develop and grow. And so we see this, for example, as I think I pointed out before, the classic case, I think the most classic case, is ovarian cancer, because we can pinpoint the damage that's done every month to one ovary or the other, alternative ovaries once a month. When that egg comes out, it doesn't just get gently released into the area around the ovary.
Explosive.
It's exploded like it's shot out of a cannon or out of a volcano, and you can see the surface of the ovary gets damaged. That's fine, normal, right? It's damaged, little damage, maybe a million cells get killed, but it
Wow.
heals. If you're glycine deficient, you get inflammation, and it tries to heal through that. And then what happens is we can see the epidemiological consequence of that when we study populations of people, large numbers of women, and we correlate the number of times that they have ovulated in their lifetime. Then we can correlate that positively with the incidence of ovarian cancer. The more times you ovulate, the more you're vulnerable to ovarian cancer. And what are the things that inhibit ovulation? Well, if you're pregnant and you have children and you breastfeed, all those things suppress ovulation. Even birth control pills suppress ovulation. So any of those things will tend to lower the risk of ovarian cancer. I mentioned birth control pills, but I like to put a caveat in there, not just to start taking them just to prevent ovarian cancer, because they actually increase the risk of breast cancer,
Right.
because of their different effects on the breast and on the ovaries. They suppress ovulation, all right, but they also stimulate the breast to grow. And you have more growth, and then every month that you don't have a baby, but you go through a menstrual cycle, then about a week before you menstruate, all that extra tissue that was generated in the breast to prepare for the potentiality of having a child to feed externally in 9 months is now gone. You don't need those cells. Those cells die off. So it's the same thing as injury. Injury is no different than any other form of cell death. And in many cases, that's programmed. Like in the breast, these extra cells that grow every month are programmed now to die because they're not needed. Again, nothing wrong, perfectly normal, nicely absorbed, reabsorbed into the tissues, no harm, no foul, unless you're glycine deficient. And then you can see that every month there's a low-grade inflammation in the breast. And surprise, surprise, you can correlate the number of menstrual cycles with the incidence of breast cancer.
Wow.
Or an interrupted pregnancy, or that any of those things that stimulates a lot of growth and then leaves a lot of cells there that can then become potentially cancerous in an environment that is inflammatory, incubator for cancer, as it were. When we talk about injury, even gross injury, like war injuries, occupational injuries, you break a bone, you have an automobile accident, multiple fractures or things like that, and you get over it, they all heal, and then somehow 20, 30, 40 years later, they still hurt. A lot of the chronic pain management industry, as part of the medical industry, has to do with treating people who are like veterans or people who are accident victims, people who have chronic, long-lasting, intense pain from injuries that have been sustained and have healed many, many years ago. Why? Because when they finally healed through all that inflammation, they healed with scar tissue. Scar tissue is not flexible like the initial tissue that it replaces. So that when you flex that joint that got injured and has scar tissue, every time you move it, you get little tears, little micro injuries, right? Like the workout and everything like that. And so it makes for inflammation, and the inflammation in turn causes pain. So much of pain these days, especially as you get older, aches and pains we take for granted as a consequence of aging, are really inflammation that is not properly, that only takes place because you're glycine deficient, and initially results from recurring micro injuries due to the fact that you were glycine deficient, and even the healing was not most naturally and optimally done, even right after the injury.
Fascinating.
Because you're glycine deficient.
That's fascinating. And I'm wondering, have you ever heard of DLPA, DL-phenylalanine, for pain?
No, they say DL-phenylalanine works for pain.
Well, I've just been reading books like 1987 books as Dr. Arnold Fox, and I have this idea to bring you and Julia Ross, who studied his work extensively and uses DLPA. It actually helps to produce our own endorphins and preserve our own endorphins. So for pain management, I was thinking that glycine and DLPA could be like really impactful for a lot of people. So we'll talk
Well,
about
it
that
might be
later.
different. Endorphins would be the kind of thing that actually is analgesic, where glycine
Yes.
is non-analgesic. So, for example,
No.
you may have aches and pains, and then, something hurts, you have a headache, you have a backache, or something like that, and I'm not glycine deficient, and that's not working. You reach for the Advil, and that works.
Right.
Because even
Yeah.
though they're said to be NSAIDs, non-steroidal anti-inflammatory drugs, they're actually analgesics. That's what the immediate effect is, that they're analgesic.
And that means pain relieving.
And that's pain relief. So I suspect
Yeah.
from what you've described about the mechanism of the DL-phenylalanine, and I imagine L-phenylalanine would be just as well, but DL would be cheaper because it'd be made synthetically. I imagine that works as an analgesic if it's going by influencing endorphins. If you're glycine deficient, that means you're not properly nourished. You should eat enough glycine as you eat enough everything else, so you have the usual spectrum of nutrition. The normal spectrum, the healthy spectrum of nutrition. Analgesia might be for that. That's
Yeah.
something when you have an injury, because injuries don't just cause pain through inflammation, they also directly will cause pain. So there's a lot of pain that's direct and pain that's indirect. It's kind of a funny thing. That's another thing I discovered about conditions like shingles. First of all, the most severe infectious disease would be like septic shock, where the body succumbs to a systemic infection. It gets into your bloodstream and it's out of control, or very, very particularly nasty bugs like anthrax, bubonic plague. This is what your immune system is designed to really bring out the nuclear weapons for. And when it does that, it's the very last step of that which creates the so-called cytokine storm that we all got familiar with during COVID, where inflammation has really gotten to the very end point, and those macrophages are really going ballistic and throwing everything they have at the infection. With a virus like that, where you can't do it, you can't kill a virus because it's not alive anyway, but you can't clear it if you're just reacting willy-nilly to the protein that's being distributed in the blood. So you get these so-called cytokine storms, and that's what killed most people during COVID. Well, in a cytokine storm, which is the very inflammation, not just in the beginning, where you have the glycine receptor, but near the end, when you have this so-called N-injurin 1, like I think,
Great.
Injurin 1 is
Sounds like
another cellular surface protein. It's not a glycine receptor. It's not the glycine receptor, the classical one I described before, the glycine-gated chloride channel. It's another form of a glycine receptor. It's another cell surface protein that binds glycine specifically, which stops that final nuclear stage where the so-called inflammasome is created and then allows cells, these macrophages, to then swell up with water and then burst. And when they burst, they just blast inflammatory poisons all over the place. So that does a lot of damage. Now you wonder why is the body designed to do that? If it does that, what limits that? Well, what normally limits that is the fact that your glycine levels inside the cells are much higher than the levels outside, because there are glycine pumps that pump glycine from outside the cell inside. That keeps that gradient, that difference of glycine. So therefore, when you start blowing up all these cells, you get lots of inflammatory mediators strewn around willy-nilly, but you also blast a lot of glycine around, which then limits the initiation of inflammation, and so the process becomes self-limiting, again, because of glycine. However, if you're glycine deficient, once you get that cytokine storm, you're dead, right? It's really too far gone. Well, who were the people during COVID now? Who were the people who succumbed to the cytokine storm and who didn't recover from getting COVID pneumonia? People with diabetes, people with cancer, people who were obese and didn't even have diabetes. Very interesting, right? People who are obese, guess what? Even if they don't have diabetes, they make less glycine. People with advanced age. So it's the elderly, obese, cancer patients, diabetics. These were these so-called comorbidities, right? So that could make us feel like we know a lot about it because we use a fancy word like comorbidity. That's what the doctors do, right? Oh, well, those are the comorbidities, which makes you think, hey, this guy knows a lot. He knows what he's talking about. He uses words like comorbidity. You know what I mean?
Yeah, so what you're saying is glycine prevents kind of like that sepsis.
Yes, so glycine is like the alpha and the omega. It's the trigger lock that stops the first step in inflammation. Yes. And it's also the final brakes that stops the last step of inflammation from propagating to the point where it becomes life-threatening. So glycine has been shown in animal models, for example, to prevent septic shock. So you look at something like COVID. What was with COVID? I had COVID. You know, glycine, or my glycine supplement, you know, full disclosure here, not designed to prevent or treat or diagnose any disease, right? Make the FDA people happy, and it doesn't do that. But it's a nutrient which certainly has an effect on how these diseases will affect you. So in the case of COVID, what caused the cytokine storm was this spike protein, right? That nasty little spike protein, which provokes macrophages to cause inflammation. And that generated the cytokine storm. But if you have enough glycine around, guess what? Does that prevent COVID? No. I had COVID, and you know what? It's probably about the nastiest intestinal flu I've ever had. That's what it felt like. I felt really lousy for 2 weeks, going on 3 weeks probably. I still didn't feel right. That is a generalized malaise. And I felt really bad, and I needed to sleep about 12 hours a day. Or 12 hours a night. But that's all. I mean, I wasn't bedridden. I felt bad. I had a fever spiking to about 101 for a day. I had diarrhea for several hours. My sense of smell went away for a couple of weeks and then it came back. My sense of taste was altered. I would not recommend getting COVID, but I did not have COVID pneumonia. Not one cough, not one sneeze, not one wheeze. It was not a respiratory infection because my alveolar macrophages, those are the ones that would go bonkers and kill people with that COVID pneumonia, that cytokine storm. That didn't happen to me or any of my friends who took glycine supplements, even those who had lung problems. I had one friend who was my age at the time, in her late 60s, and she had, less than a year before, she had undergone lung surgery in order to take care of sometimes air bubbles get in the lungs, that kind of thing. She needed to have lung surgery. And she got COVID, and she was taking Sweetamine, my glycine supplement, and she didn't have any trouble with it. It wasn't fun for her either. It's not fun, but she didn't get that horrible respiratory disease. So all of the comorbidities, and use that word again, all of them are in populations of people that are known to be generally glycine deficient. They have low glycine levels. If you look at studies on people with obesity, studies on people with diabetes, studies on people with cancer, studies on people who are very old, they all have glycine levels that are lower than other people who don't have those conditions. So the low glycine, if there's not enough glycine around, when it gets to that final stage of inflammation where you get the cytokine storm, there's just not enough glycine to stop it. There's not enough glycine to stop it from starting, and there's not enough glycine to stop it from killing you in the end, and then you're done. So it's glycine in the beginning, glycine in the end. Glycine is the alpha and omega of inflammation. One of the reasons I titled my book The Glycine Miracle, because it does so many things. And then some other people say, well, it can't all be that simple. You know, the doctors will tell you that this condition and that condition, well, it's very complex. You know, but complexity is usually a cover for not wanting to admit that they don't know what they're talking about. Oh, what causes this or that? Well, that's very complex. Why do people die from COVID pneumonia? Well, the reasons are very complex. No, they're not. They're really very simple. And people say, well, you can't be that simple. You know, science is much more complex. But in fact, here's another generalized misunderstanding about science. and the scientific method that everybody knows or should know. And that is, you don't reject a hypothesis because it's too simple. You reject a hypothesis because it's too complicated. When you find the answer, the simplest answer that actually answers the question, that satisfies the hypothesis or cures the medical condition, then you know that's the answer, the simplest one. It's, just like back to the old days when Ptolemy, promulgated this theory, of course, that the planets and the sun all revolved around the Earth. And they developed these astronomical observations, and they tied them into these complex epicycles. All the planets and the sun revolve around the Earth in complex epicycles. Well, why did we throw that out? Because Copernicus came around and said, no, very simple. We all revolve around the sun in simple elliptical orbits. That solves everything. All of a sudden, all the observations now make sense. You don't have to sort of, Mars is a little bit out of place. We've got to tweak its epicycle here and there, and Jupiter is a little bit... They did that. There's some studies done of the old Ptolemaic observations, and they noticed that some of the observations were a little bit off because they were kind of, they tweaked the data a little bit. They massaged the data a little bit to make it fit the theory, which is something you never do. You don't alter the data to fit the theory. You alter the theory to fit the data. If the data don't match, your theory's no good.
That's
but
right.
This is one of those things, when I discovered just what glycine can do and what others had said about this. Incidentally, all these miraculous things that glycine does, glycine, in terms of its operation of the first step in the inflammatory cascade, most of that was elucidated by a group at the University of North Carolina under a fellow named Ron Thurman, who was a toxicologist who unfortunately passed away of a heart attack, and he's only about 61 years old. So a lot of the work kind of stopped after, in the early 2000s. I think he died in 2001. But they worked out this whole glycine receptor, glycine-gated chloride channel, at macrophages. They didn't quite get to the point of realizing that this was a nutrient that was really essential, to the point of understanding that inflammation was not a normal response to injury. Probably because everybody thinks, glycine is a non-essential nutrient, so why should that be? And if it helps this condition and that condition and the other condition, why, what a great drug. Because we have this drug mentality. Anything that can alleviate pain or ameliorate any particular disease condition, we say, wow, what a great drug. Then somebody says, well, you can't patent glycine, it's just an amino acid. So then laboratories get to work devising something synthetic that maybe is just as good or better than glycine. They haven't found anything better yet that I know, so that they can then patent it and market it as a drug. So these are the various perverse incentives in our healthcare system, which unfortunately will take us away from the truth about what's really good and essential for us and our health. So, you got to just get around these incentives and just try and be pure about the science. That is to say, to get rid of preconceived notions. With me, I didn't get rid of preconceived notions because I'm somehow good at it. I just did some self-experimentation. And when I had conditions, when I suffered a serious fall, when I had a serious sunburn, and all of a sudden, guess what? There's no inflammation. That were the results, the dramatic results of my self-experimentation of taking 10 grams a day of glycine, starting in 2008. So when these things happened to me in 2010, it was, right, the light bulb went off. And that was it.
And I want to encourage you all, because someone did, like I said in the beginning, someone shared their Dr. Brind story. And I want to encourage you guys all, if you have a Dr. Brind story, if you've been taking glycine and you're not having that kind of like disability as a result of doing hard labor the day before, you fall and you bruise, but you don't have pain, you're not immobilized, or you're out in the sun and you get sunburned, but you don't have that extreme swelling and pain. Like, we want to hear your Dr. Brind story. So share them in the comments below. And we're going to get to how to supplement and how to eat enough glycine in a second. But now, Dr. Brind, I just kind of want to take you, because we've been doing at this a while, but there's a lot of other questions about specific conditions. So I'm just going to give you like 1 or 2 sentences. Just let me know if you think it might be helpful. Again, never medical advice. Just, I'm going to...
Or if I know anything.
Yeah, maybe you won't know anything, but first thing...
Like you quoted a study just a few minutes ago that I'd never heard of. So
that's okay.
DL-phenylalanine for pain via endorphins.
You know what you got to read? It's this, to end chronic pain and depression. So it's interesting, but we'll hear more on that later. But now, okay, I want you to tell me about autism, maybe linked to
Yeah.
inflammation. Do you feel
Yeah,
like
I
glycine?
published a letter in the British Medical Journal about 10 years ago about autism because the work was just coming out that it was really an inflammatory disease because they noticed that in doing autopsies of brains of autistic kids who had died, there was the kinds of degeneration that showed inflammation in the brain. These people are very susceptible to eating too much dairy, so you hear a lot of stories about how kids with autism do a lot better when they're taken off dairy, because kids, they're always getting milk pushed on them. You got to have milk, all of that stuff. And milk protein, the main milk protein, cow casein, is high in methionine and low in glycine. Whey protein, which is a more minor protein, it's almost like the muscle and the bone, the casein and the whey protein.
Is it high? Whey is higher in glycine?
Whey is higher in glycine, so whey protein isolate, which is not the major protein, it's the minor protein of milk, is high in glycine. It's a good source of glycine. Casein is a good source of methionine, and it tends to deplete glycine. So that, and just a lot of dietary studies, other studies basically showing that inflammation was very much going on. Brain inflammation led me to believe that it was really largely a glycine deficiency condition. There may be other things contributing also. I
Is there
should
research there?
reread that. So that's about it. It was a 1,000-page letter. I know, 1,000-word letter. I know because that was the word limit when you submit it to the journal. It had to be 1,000 words or less. So it's it's a great
And what
exercise.
happened?
To me, struck me as really a glycine deficiency condition. Maybe not the whole story, but things like prematurity also has to do with it, which may have to do with glycine deficiency in the mother. I mean, if you're eating a glycine deficient diet as a kid, your mother's probably not doing much better because you're her kid, right? So
Yeah, very interesting. I just hope that there's more research there. What about depression? Interesting, because there's a new glycine receptor discovered around depression. Depression is, for at least some subsets, related to inflammation. What do you think? Do you feel
I
like
don't really know much about that. I heard about that, some new glycine receptor kind of thing, but I don't really, nothing enough that I could give anybody any more knowledge about that. That's something new. Glycine is even more miraculous than we know. I sort of view glycine in an interesting way as a miracle substance because glycine is D or L-Glycine. Everybody knows the amino acids, the natural form of the L form and the synthetic form are like 50% D and 50% L. It has to do with a molecule being the same as its mirror image. Like, for example, your right hand and your left hand are not identical. They're mirror images. But some molecules are so simple that the mirror image is the same. Like a water molecule. Every water molecule is the same as every other water molecule because if it looks at itself in the mirror, it's the same. It's symmetrical. So glycine is symmetrical. It's the only one of the 20 protein-forming amino acids that's actually symmetrical. So there is no D or L. So beware when somebody sells you L-glycine, and lots of people sell you L-glycine, which is baloney. There is no L and D glycine. It's just glycine. That's just chemical ignorance. It might be okay, but it means the people who are selling it don't understand it. Don't know literally the first thing about what they're selling you.
Which is true of so many people because so many supplements are made by marketers.
Right,
Just
yeah.
throwing
And
that out there.
so, it's good to get a supplement from somebody who actually knows why and how it was formulated and what it does and how it does it. So that's, and I try to, make it convenient and, and easy to use and easy to travel with. But you have to understand when you sell a supplement and you want to make it easy and convenient, so you put it in a stick pack, or even if you put it in a capsule, those things are very labor intensive. So people will comment and they say, oh yeah, this Brind guy just wants to sell glycine. I can get it so much cheaper. Well, yeah, you can get coffee cheaper if you make it yourself, but a lot of people go to Starbucks and Dunkin' Donuts, where you pay 20 times as much for a cup of coffee, but it's still cheap. So the same thing is true with my sweetamine. You can get it cheaper. If you buy bulk glycine, just the powder, go for it. You can get it cheaper if you don't mind the taste, because it doesn't taste great if you just take it by itself. You want to formulate it yourself and mix it with whatever you like. You want to, measure it out and take it, get a little scale and measure out how much glycine you have. Go for it. It's cheaper that way. But that's because packaging it into stick packs or into capsules or anything like that is like more than half the cost of it, more than the raw materials. So that's why. It's not like everybody wants to mark things up to the moon just so they can get rich off it or anything. I mean, It's not a, drug companies don't sell it. They don't like to sell it because they can't patent it, and they can't really make serious money on it. So that's the way it is with supplements. If you want to get it just as a bulk powder, get it as a bulk powder from any of the companies online that sell you bulk powders. I will tell you that if you get it from them, it's probably from the same kind of sources that I use. So it's probably just as good. One friend in Australia who said, well, I don't know, I can't get your product in Australia. We do ship to Australia. It costs a fortune, but we do ship to Australia. But I had an Australian friend, this is about 10 years ago, and she said, well, I bought this glycine, from a pharmacy, and they sold it to me, and it didn't help me at all. She used to swim a lot. She was in her 80s, and she used to swim a lot. She said, now I'm pulling muscles all over the place. It may be because she overexerted herself. But I said, send me the glycine that you get. So she actually sent me the package of glycine. And it was made by a division of the Nestle company in Australia, and it was made, I think, in Japan. And I opened it up, and I was blown away by the odor of pyridine, which is a really foul-smelling industrial solvent. And I opened up this Nestle's brand of glycine from Australia, and oh my God, it was... So if it smells with a horrible industrial smell, don't take it.
Yeah, and that's a good point. The solvents can be used and can remain.
I mean, most glycine, they don't use pyridine because it's very hard to get rid of. But most of the glycine they can get, anybody, that sells you glycine, you can pretty much be confident that it's just glycine. But the other thing is that people will use TMG, they'll use trimethylglycine. Trimethylglycine it's a different compound. It in fact has the opposite effect as far as methyl groups are concerned. So if you're a low methylator, TMG may be something that's good for you in between meals because it will help to recycle that methionine, because otherwise your liver just gets rid of it. And when you're a low methylator, it's because you're not recycling the methionine. But taking glycine will not affect your ability to recycle methionine, which is an essential amino acid. I know because we tried that. When we found that having low methionine was actually good for longevity in rats and mice, and we tried feeding glycine to see if that would mimic by helping to clear the methionine, because glycine is used to clear methionine, but it didn't make any difference in the methionine levels. So although glycine is used to clear methionine, adding more glycine will not waste methionine, but adding more methionine will waste glycine. Mm-hmm. So that's the way it works, we found out.
Perfect.
So if you're a low methylator and you usually have to take a high protein snack in between meals, most low methylators kind of know who they are. They have these genetic variants which impede the ability of your liver to recycle and regenerate the methionine. It's good to have glycine anyway as a supplement, but then in between meals you can take a methionine supplement. The best methionine supplement I know is Brazil nuts.
And someone was saying because of the selenium toxicity potential, how many do you want to, would like one Brazil nut a day be an adequate?
You can have a few Brazil nuts in a day, but you wouldn't have a handful of them every day and snack on them. 3 average sized Brazil nuts is 100 milligrams of methionine, and it's not that much selenium, and it's organic selenium. You're not going to get selenium poisoning from 3 Brazil nuts in a day, no. Or trimethylglycine will also work. Trimethylglycine is also called betaine, because what that does, it fuels an alternative mechanism that your liver has for recycling methionine. Or you could also take methylfolate, because methylfolate is what is not made when you have one of these variants like C677T. You don't make methylfolate very efficiently. If you take methylfolate and or trimethylglycine and or Brazil nuts or some other source of methionine, you work it out kind of what works for you. One thing's sure, this is a variant which is very persistent in human populations all around the world, 10%, 15%, 20% in some cases, depending on your ethnicity, of low methylators. Why are there so many low methylators? Well, because it doesn't really impede your life expectancy or fertility or anything like that. So it persists in human populations over the centuries. It's not like, you have this, you're less likely to survive. No, it's just a matter of, activity levels in between meals more than anything else that you can compensate for it. Precisely because your body has so many different ways of regenerating methionine, because it is so essential. That's why you need it, but you need less of it. Right?
Awesome. Okay, 3 more inflammatory conditions, and then we're going to just say how you can get it. So cystic fibrosis.
Yeah, cystic fibrosis is an interesting one. 2 things. There is some research on cystic fibrosis, some good research that shows, there have been recent clinical trials that show it helps a lot. Why? Because one of the key symptoms of cystic fibrosis is very heavy inflammation, especially in the lungs, that makes breathing difficult. And so that inflammation is ameliorated a lot. When they feed these people glycine supplements, they do a lot better. But there's an even more subtle way that I think, and nobody's tested this as far as I know, is that cystic fibrosis is because you have one of these genetic variants in a gene called CFTR, cystic fibrosis transporter receptor. Guess what that is? It's a chloride channel. It's not glycine gated, but because it's a chloride channel, that's malfunctioning so that the cells are not allowing enough chloride in. It may be, again, this is my theory, if you have enough glycine, if you do take glycine supplementation and you're not glycine deficient, those glycine-gated chloride channels may provide enough redundancy of chloride conductance so that you can have cystic fibrosis and really not be sick. In other words, in the extreme, my hypothesis would suggest that cystic fibrosis may in fact be a genetic variant that's not really a disease, but which produces disease in the face of a glycine deficiency.
Interesting.
So because, again, not only because of its effect on inflammation after you start getting disease symptoms from cystic fibrosis, but in the initial part of it where it may be able to correct for the initial defect through the glycine receptor.
Fascinating. And now I have both genes for Alzheimer's. Microglia activation, we know, kind of drives neurodegeneration. Given that in the central nervous system, the glycine can kind of keep our, brain a little calmer. Do you foresee, has there been any good research around neurodegeneration, cognitive decline, and glycine? Do you hypothesize that could be helpful?
Yes, well, there's both hypotheses and there's some research. I don't think there's a lot of research in terms of Alzheimer's, age-related dementia. But first, I wanted to go back to something you just said. You threw around the term microglia like it's a whole new cell type nobody's ever heard of. Microglia are the brain macrophages. See, macrophages, they're the first responders in every organ. Every tissue has them, even if they haven't been identified. They will be. There are specific macrophages, and then there's an army reserve in the blood where those neutrophils can be recruited, and eosinophils can be recruited, and also monocytes can be recruited to come into the tissues and act to beef up that army of macrophages that's there to fight whatever infection there is, or isn't, if you're glycine deficient. So I know from my own experience, well, really experience of others, a lot of it's anecdotal, but it just fits too well, and I'm very confident of it, and that is that head trauma. For example, I had a serious fall and hit my head, and it was like the old westerns where the bad guy would come in with the butt of his pistol and clock the bank. And I was very dehydrated one day, and so I got up too quickly from sitting, and I had just driven like 3 hours, and I didn't have anything to drink, and then I had a glass of wine without having a glass of water first. See, sounds dehydrated already. And then I felt faint and just blacked out for enough fraction of a second to fall and hit my head on the sharp point of a wooden kitchen table, and bam, I was on the floor, and I woke up probably less than a minute later, and I was confused, and I didn't even know what Sweetamine was, my own product. Imagine. My kids were saying, what about Sweetamine? I say, Sweetamine, that sounds like, that's a good idea. What a nice name for something, I had a serious concussion, and I went to the ER. They called the ambulance and took me to the ER and so on. Well, after about 2 hours in the ER, I was talking, I was awake, everything was okay, except my head was really, it really hurt right there for about 2 hours. Then the pain went away. And then I was just fine. It was tender for a while, if I pressed on it, but didn't bother me, didn't hurt. And then it just went away. Did I ever have any blackouts or any episodes or any kind of sequelae that they describe for a concussion? No, nothing. Oh, how long ago did this happen? It happened almost to the day, because I know it was April of 2018. So it happened exactly 8 years ago.
Wow.
Nothing.
And you're good.
Yeah, nothing. No residual anything. Why? Because, again, the microglia are the brain macrophages. So every tissue has it. They don't cross the blood-brain barrier. They're there. They're resident. But glycine crosses the blood-brain barrier. So you have those getting activated in the face of injury, and they don't do you any good in terms of healing the injury when you get a traumatic brain injury. The healing takes place. The microglia will do you some good, but not if they cause inflammation. So it's the microglia, which are the brain macrophages, that generate the inflammatory response, and that causes damage, and that's what causes the chronic and recurring damage. And it's, of course, we all know, that chronic traumatic brain injury elevates the risk for Parkinson's disease, things that, diseases which are secondary, known to be secondary to brain injury. And so that's, brain tumors used to be associated with head injury. I know it was my ex-mother-in-law whose mother died. She died when she was, probably in her 30s after she started having children, because as a child she had a sledding accident and hit her head and had, a traumatic brain injury when she was a child, which ultimately came back as a brain tumor. Decades later,
Wow.
30 years later.
That unresolved inflammation.
Yeah, and there are reports, you've seen reports in the literature, going back a long time that trauma to a particular tissue, might result in cancer of that tissue later on. So again, that gets back into the example of ovulation and chronic injury and so on. But now I think we can safely assume that this is because of chronic inflammation, just like in many cases, like Alzheimer's, they say maybe chronic inflammation. Now, the trouble with Alzheimer's is that once you start to see the signs of dementia, it may be not easy to reverse. However, there are various claims of different things being able to reverse that damage. I'm not really aware of that literature. I'm aware of it, but I'm not really familiar with it. So that's something, it may be that, but I know that people that friends of mine who had like spouses that were undergoing, or family members who had dementia, that glycine did not really, once they had dementia, glycine did not really help to slow the progression of the disease. So it may be that it may be that it has to be done earlier, but that doesn't mean there aren't other things that can do that. I think there's some promising research out there, but I'm not really familiar with it.
Thanks, Dr. Brind. Yeah, Dr. Bredesen has been on the podcast, and he's reversed many cases of Alzheimer's with this 36 holes. It's very bio-individualized, but
Okay.
yeah, I see glycine as more like don't be deficient so that inflammation doesn't happen inappropriately and that microglia activation doesn't become chronic. And so thanks for that. And the last one I want to ask about is autoimmune conditions. We have people specifically asking about things like ulcerative colitis and IBD, and I'm even thinking like multiple sclerosis. Is there any good research or any great hypotheses you have about?
Well, I know from customer testimonials a lot of these things that they
Great.
help. Again, it's the secondary, at least is as much is beneficial in the sense of taking care of more secondary symptoms of these things. So, for example, a friend of my daughter's who has lupus, she said, "Oh, you ought to try Sweetamine." So she gave her some Sweetamine. She started using that, and she said, "Wow, after a week or so of this." She said, when I get up in the morning, I can actually close my hand, bend my knuckles without extreme pain. Work my hand in the morning from the stiffness. Because again, a lot of these conditions cause secondary inflammation. Now, so as far as the primary disease, whether it's like rheumatoid arthritis, and it also helps that because of the secondary inflammation. Whenever there's a real autoimmune disease, and I'm not sure Crohn's disease, well, that may be one where you actually have antibodies now. It may help in preventing these conditions, presumably, theoretically, because again, why do you make specific antibodies against things? It's because these are certain molecules or certain fragments of cells that have been eaten by macrophages, which then signal other immune cells to initiate an immune response to. And some of this may have to do with over-vaccination. A lot of it has to do with leaky gut, and then with leaky gut you may get allergic to things like wheat gluten, secondary to that. Once you make an allergic response, that means you have specific antibodies now against this particular substance. And so just taking glycine won't block that reaction to it, but it may make the reaction much milder by stopping the secondary inflammation. So For example, a condition that I have is poison ivy allergy. Most people will get poison ivy allergy. If they're not allergic to poison ivy, they can be induced to get it because poison ivy urushiol, the oils in poison ivy, are very, very strongly allergenic. So I always had a very strong poison ivy allergy since I was a kid. And if I managed to, even in gardening, if a poison ivy leaf should ever so faintly just barely touch the surface of my skin, it would within a day or two it would start bubbling up into this really ugly, tremendously itchy, ulcerating kind of a rash, which is most of us are probably familiar with poison ivy. So then after I started taking glycine supplements and had my Sweetamine, I still do gardening, and when I do gardening, I'm very careful. I use plastic bags as gloves, and just pull up the poison ivy very carefully and not touch it and so on. And a couple of times, I would get, leaves of poison ivy would, touch the back of my hand and so on. I was noticing I wasn't getting any reaction. So I thought, I wonder if glycine is helping me lose my sensitivity to poison ivy. So I did it, one of these self-experimentation routines. I took, with a gloved hand, right hand, I took a leaf of poison ivy and rubbed it real good on the back of my left hand to see if it would generate a response. Sure enough, a day or two later, that big, ugly, those big white bumps, just like a typical poison ivy reaction, and it itched a little bit, but then went away. The itch from the skin changing its topography will make it itch, and then it stopped itching. So it still looked pretty bad, like the initial response, but it was not that spreading, ugly, really, really annoying, serious itch that was going on. That didn't happen. Mm-hmm. And a lot of times, as I say, when I have a very light touch of poison ivy, it doesn't seem to do anything. And then, of course, the most dramatic effect was, again, infectious disease, was shingles. I got shingles in 2015, and I had it for most of the summer. And I felt a little bit of malaise, like a mild, not quite feeling right. But I had the classic shingles rash. Lower back, unilateral, looks in a particular way, a very characteristic rash, which was confirmed by my neurologist. And the funny thing about it was, although it was a classic case in every way, except one, and that is that I only felt the rash because I felt it with my hand, feeling those bumps on my skin and wondering what they were, and then looking at it in the mirror and seeing that it was shingles. So it was a completely painless experience of having shingles. And I have had others, like customer testimonials, say that they had really bad shingles. And I hear the stories about shingles. It's like your skin is on fire. It's really excruciating. And that's why people are willing to take a vaccine for it. For me, I might get shingles again. I don't know. Nothing I would take a vaccine for. It was a very minor nuisance.
That's amazing.
But that seems to be a general thing, that wherever, and the same thing is true with gout, whenever you have some kind of disease condition that produces a flare-up of any kind, typically flare-ups will produce secondary inflammation and pain. So if you have enough glycine in you, they won't do that. So I've had, friends with gout who say, it's, the flare-ups are no big deal anymore. Shingles, gout, poison ivy, so it does all of these things. It can take care of the secondary symptoms because the inflammation that usually follows these conditions is inappropriate and really just a symptom of glycine deficiency.
That is amazing. Okay, and so just to wrap this up, we've talked about most people are glycine deficient. We need 8 to 10 grams a day. So you can put your bones in your soup. You can eat bone broth. You can have bone broth protein powder. You can have collagen. You can have gelatin. You can also try Sweetamine, which is his product that takes Sweetamine and cuts that bitter aftertaste, right? So you can add to your oatmeal.
That's right.
Sweetamine lemonade.
Use it like sugar. It tastes more like sugar, but there's no sugar in it. Won't raise your blood sugar,
Yeah, and he makes like a lemonade in the morning, like lemon juice.
Yeah, like if you take straight lemon juice, well, maybe cut it 1 in 2 instead of 1 in 20.
Yeah.
And add a packet of Sweetamine. So you have maybe 4 ounces of what tastes like a sweet lemon juice, without the, tremendous astringent qualities of the lemon. So, I like to do that in the morning. So you can have it with your coffee. I used to have it with my coffee, but I didn't really like coffee with sweetener in it. I got used to it, but I prefer not having my coffee sweet. coffee, tea, people sprinkle it on oatmeal. Some people just can't abide sweetness because glycine has its own sweet taste. And they just don't like, there are people, they just don't like anything sweet. So I've had customers say, oh, can you take the sweetener out of your product? And I say, sorry, glycine is the main sweetener because it's sweet. If you really can't stand it, take gelatin.
Yes,
It's
yes.
basically denatured collagen. It's tasteless. You know, you need about 4 times as much by weight. 4 grams of gelatin powder is the equivalent of 1 gram of glycine powder. You can use that, and you can get that online, and that way you can mix that in your juices or your smoothies or whatever you want, and you can get all the benefits of glycine without the taste because, and even so, some people get GI upset. It makes them gassy, it gives them diarrhea. Not many. Most people it doesn't have any effect, but some people for whom it has that GI effect. Why does it have that GI effect if it's natural? Well, it's not the natural way to eat it. Usually, because glycine is a protein amino acid, and in the diet you usually get it as part of collagen or gelatin, in which case it needs digestion so that it's absorbed more slowly lower down in your digestive tract. When you take it as a free amino acid, you know, if it doesn't bother you, fine. But if it does bother you, do it with gelatin. I've had some people who say for some reason I can't take it even with gelatin now. Even gelatin makes me,
And maybe just too concentrated. In that case, try a
I don't know
bone
what
broth.
it is. I don't know what to tell
Yeah.
them. You got to have glycine. I say you got to get it one way or the other. You don't need my product. You
Yeah.
can do bone broth. You can even take enough magnesium glycinate, as we said before. When you take
And
those
you can eat
two big pills
collagen.
of magnesium glycinate to get your 300 milligrams of magnesium, you're also getting 2,000 milligrams of glycine with it.
I love that.
So that
And that's
helps.
what I've said, and a lot of people in the comments are like, and I want to ask, yeah, two more questions, but yes, you can go, Sweet Amine is going to give you all in one, like 8 grams in one,
Yeah,
or
right.
you want to back it off and take, the other glycine powder and then distribute it differently throughout the day. So it's not just
You can
one
do
dose.
the sweetamine too. It's a powder, so if you
There you
open
go.
the packet and don't use it all at once, you can spread it out if you want.
There you go. Or you can do, like you say, bone broth throughout the day or collagen. So there's many different ways to fill that gap. Now, some people, this is the last one. Do you see any time where, like pre-surgery, pre-dental procedure, when you get injured, is there a time when you want to increase your dose, or do you think that 8 to 10 grams is going to be adequate no matter what
No, I
life
think 8 to 10 grams is enough. Yeah, I mean there
is
are
enough?
times when people who say that some condition's still causing pain and inflammation, and it seems to help a little, but is it okay to take more? So it's fine. Take 16 grams. I took 40 grams a day of straight glycine for a month and felt fine. And people have also, for using it for psychiatric conditions like mood disorders, bipolar, and schizophrenia, have given patients 60 grams a day. But if you really want to see, and some people have said, oh, glycine is hazardous to take, and they cite some study where they injected rats with, literally injected them with glycine solution straight into their body cavity and say, oh, look at that, some of them died. Glycine is so unbelievably safe. If you really want to see how safe it is, you have to go to the urologic surgery literature, believe it or not. You look under TURP, T-U-R-P, a urologic surgery for benign prostatic hypertrophy. Then that surgery has been done. It's a very crude kind of surgery. It's kind of a roto-rooter through the urethra. Really don't want to talk about it any more than that. It's
Enough
just
information. Just
it's
kidding.
kind of blood curdling, but the thing is, men do very well on it. They recover very well, they heal very well, and everything like that. Why? They irrigate the surgical site. And this surgery was perfected over 100 years ago, in 1925. They started doing this, and they still do it. It's still effective because they typically irrigate the surgical site with 2% glycine solution, because you have to make it the same ionic strength as blood, but you don't want to put salt in an open wound, right? So they 2% glycine works well. Well, what happens is when they've taken a look at glycine measurements, in extreme cases, some people have had serious sequelae. They feel sort of sick for a while, for a few hours. They may feel nauseous or whatever for a few hours. And in extreme cases, there's even been cases of blindness where the blindness will last for some hours and then it goes away. Well, they do measure the blood levels, and they see that sometimes the blood levels of glycine go up to 100 millimolar. That's about 200 times a healthy glycine level, 100 or more times the glycine level, way, way, way out of bounds for what glycine should be. And it doesn't do any harm. It doesn't do any lasting harm. In fact, that's probably why I think this surgical procedure is so successful and tolerated so well by men who undergo it, is because they have now glycine levels are pumped up so high that they're not going to feel any pain for a week from anything. And by
They're juiced up.
and healing, and because there isn't any inflammation, there's a tremendous acceleration, or certainly no impediment to the most rapid healing that's possible. So they heal quickly. They don't feel residual pain. It's great because they load it up with glycine. And people who do that kind of surgery, they don't even know it. They never talk about the glycine. Okay, there's some research papers that show, ooh, glycine levels are so high, maybe we shouldn't do it. It's not so sick. But that's what's showing you that I believe that you literally can't even, no matter how concentrated you make a glycine solution, I don't even think you could drink enough to do you any real harm. When you irrigate a surgical site like that and you're literally pouring it right into the veins and you get enormously, astronomically high levels of glycine, it still doesn't kill anybody or do anybody any permanent harm. You know, it may, in the most extreme case, may make you blind for a few hours because of its
So don't try that at home.
inhibitory effects. It's so high that your optic nerve just literally stops working. And then as the levels clear out, because glycine is a small molecule, it's water soluble, cycles through you very quickly. That's why I say you need it every day. It's part of a daily diet. Like, fats, vitamin D or, vitamin E or essential fatty acids, you need to have, make sure you have them a couple times a week. But glycine, you really need to have it, every day because it cycles through you in a matter of hours. So you build up a healthy concentration in 2 or 3 days, and you take it every day, and it stays at that level.
Love it. Thank you for that point. And yeah, don't try that irrigation at home. Definitely don't. And
That's surgery. No self-surgery. Don't do that. Yeah.
Just kidding. And then my last question, and then you can tell more to connect with you, is I have a lot of people in the comments. This is one that comes up all the time. Glycine makes me feel tired. And it seems like is there a paradoxical responders sometimes that you see?
There probably is, yeah. There are some,
it's just
some people.
A small percentage of the population, but
because
nothing
everybody's
you
genetically
see.
a little different, and they may handle it differently, just as they may handle differently the fact that they're taking the free amino acid rather than the amino acid as part of a protein as it is in collagen. Fortunately, it's very easy to get that way. And some people also, another compound people talk about taking glutathione, how glutathione is such a wonderful end-all and be-all. I'm not a big fan of glutathione. It is an important antioxidant, but I think it tends to be a little overrated. In fact, glutathione, they say it's an important antioxidant, it's important, with inflammation and so on. Well, glutathione is actually a byproduct of methionine metabolism. Not only does it tend to deplete glycine, but one of the ways it depletes glycine is by using that glycine to make glutathione. So when you have excess methionine, you need more glutathione. We found this out in studying our methionine restriction experiments with rats and mice, and that is when they give just barely enough methionine to survive, they end up surviving, but they live 30 or 40% longer. And their levels of glutathione are lower, not higher. Why does glutathione work so well if you take lots of glutathione? Glutathione is just as good a source of glycine as collagen or gelatin. It's about 25% glycine by weight. So I think that's why glutathione, people who take lots of glutathione would report benefits that way. Same thing with people who say magnesium is so wonderful because they take magnesium glycinate, they're taking a lot of glycine. So glycine supplementation can be effected in many different ways, either a straight glycine supplement such as iCell or, any of these other ways. But it's missing in the diet. That's my main point. It's deficient because we've always treated it as a non-essential amino acid. We throw away the bones because they're a pain in the ass to deal with. You have to boil them for hours, and make gelatin and everything. Now that you can buy gelatin so easily, now that you can, or buy glycine so easily, you have all of these avenues available for getting all the nutrition you need. Glycine is one of those nutrients. So however you get it, just make sure you get it up.
That's as perfect a place to end as possible as I could possibly imagine. But you have a Glycine Miracle book We will link to it below. You have Sweetamine. We will link to that below. And if you have an idea for an upcoming podcast with Dr. Brind and I, or a Dr. Brind story, as people have started to call them, please let us know in the comments below. Dr. Brind, do you want to tell people where to connect with you outside of that, or do you have any final words?
Oh, yeah, just the website is Sweetamine, SWEETAMINE.com. Of course, there's a contact page, there's a testimonial page. If you leave an email there, or if you call our number 1-855-GET-SWEET, you can call us on the phone. You can place orders on the phone. You can cancel orders on the phone. You can do whatever you want. We sell it risk-free. So you could buy like a 12-day challenge, we call it. You get 12 daily packets of Sweetamine. It's enough for you to try. Go on it, go off it, see what it does for you, what it doesn't do for you. And if you don't like it for any reason, just tell us, call us, email us, whatever you want to do, and say you want your money back, and we give you your money back. It's risk. That's what we mean by risk-free. We don't want to charge you anything if you don't want to use it. If it's not of any value to you, you shouldn't have to pay for it. That being said, don't start ordering 20 boxes and then say, I don't like it, give me my money back. You got to send me back at least 19 boxes. You can get one box. One box is risk-free, or one 12-day box is 30, by the way, a month supply, or one 12-day challenge. That's on the house. If you don't like it, you don't have to send it back. And you can still, if you've bought more, if you've gone head over heels for it, and you really end up not liking the product because you may be one of these people who, can't take the free amino acid and so on. Whatever the reason, if you buy more than one box, then we will expect you to return the others if you want a refund. But we try to keep it reasonable. And some people say, well, why risk-free? Why not just give it away free? And I tried that, and I found out that when you give things away for free, people don't value them. So we want you to have some skin in the game. Plunk down your credit card and buy that 12-day challenge or that monthly supply box. And if you don't like it, then you get it all back. But I want you to have a little skin in the game. I give it away free only to people that, like in a small group, I've had time to explain it one-on-one. Then I know at least you're going to try it.
Yeah.
So that's what it is. It's risk-free. And then again, it's not expensive. People who buy it on a regular basis end up paying maybe about $1 a day. It may be 10 times more than you'll pay if you buy your own Sweetamine powder, because maybe you can do that for 10 or 15 cents a day. Yeah. But it's still not a lot of money, So, like 1,000 times 0 is 0, or, 20 dimes is still not a lot of money, that kind of thing.
Yeah, I love that. Thanks.
Not a lot.
Yeah, and what Dr. Brind has done for, turning glycine into Sweetamine, we kind of did with bone broth. So you can make your own bone broth at home for very cheap. Sure. Or you can try, we have so many like chocolate, caramel, savory, and we just kind of jazzed it up a bit. We made it more delicious. So you can just, any way you get it, the point is to get it. Let us know if you have any questions for Dr. Brind in the comments. And I just want to put on your radar, we're going to do a glycine masterclass with Dr. Brind and potentially a glycine live. So let us know if you would like to hear more.
Yeah, you talked about that a while ago. That'd be fun.
I would really enjoy that, and I think this community would really enjoy that. So let me know, again, if you'd enjoy that in the comments below. And thank you, Dr. Brind. Always a pleasure.
Okay, always a pleasure for me too. Thank you.